Umnyango wezempilo eNingizimu Afrika ukweleta izigidigidi zamarandi ngenxa yamacala obudedengu kwezokwelapha phecelezi medical negligence claims. Sikubingelela sikwamukela ohlelweni igama lami ngingobongiwe umakhumalo wakwazwane. Izazi zithi lelinani lingawuqumba phansi umnyango wezempilo nobhekene neziningi izinkinga. Kungabe budalwa yini ubudedengu ngezimpilo zabantu kanti futhi yini engenziwa ukugwema ubudedengu kwezokwelapha nokudla umnyango amabhilion wamarandi iminyaka yonke. Ake sizwe izimvo zababukeli ngobudedengu ababona ezibhedlela.
Mina as a visitor ngizovisita someone before ngifika kulelo hoto lelo athi ngidlula amanye amahoto khala abantu igulane zakhala imibhedi akuna nurse khona bathi isiphithiphithi kubhizi kuyasetshenzwa ama-nurse awekho ama-doctor awekho but bebangazi ukuthi kumele bahlale ba-prepared for anything because of umuntu ukuthi ashone ngabe uthole i-attendance ngaleso sikhathi maybe ngabe usindile but ngokudelaya kwabo-nurse nabo-doctor ngathi management gcine kushona abantu.
My friend had a miscarriage, and when she went to the hospital, she was told that no, she doesn't have the miscarriage. She's just sick over some flu or period pains, and only to find out it was really a miscarriage. So they didn't even give her the chance to explain what really happened.
Umama kwami namanje abakamenzi next mengibuza mina bathi hayi ithiye sayithini sayithi ungayithini ushile anti patient
ke hopola ka nna tsatsi le leng ke fihlile mo ke na le ngwana ke hlasizeng and then wa tsala hore ba re kenya di drip ba re kenya relief for dripping A1 and then bana ba rona ba lla kwa so re bana ba lla ba re bana ba hula
not ka ofela bona manese or di doctor mara kuna le ba ile hore ka re aba rate mosebetsi wa bona or maybe ke re aba nke mosebetsi wa bona serious like let's say motho o tile mo o need help wa kula like ummotsa o ra etsa appointment yetsa sense into
Bekuyizimvo zababukeli lezo mbukeli sikhumbuza ke ukuthi ungaba ingxenye loluhlelo ngokushayela ucingo sizwe umbuzo noma umbono wakho inombolo zethu ke zithi 0117140677 noma 0117140678 kanti ngobuye futhi usithole kumakhasi ethu okuxhumana ku Twitter @SABC Izindaba kanye na ku Facebook SABC Izindaba kuze kubelule ke mbukeli sicela uqale ngo #asikhulume #SABC News bese ke ubhala umbuzo noma umbono wakho. Ibhedlela izindawo lapho sazi ukuthi kulapho siya khona ukuthola ukwelashwa. Ezinye zezibhedlela seyidume kabi ngokungaqikeleli nobudedengu ekwelapheni iguli. Amacala obudedengu nokwelapha medical negligence claims are threatening to collapse South Africa's public health care system, with billions of rands in claims having been launched against all 9 provincial health departments. Ungqongqoshe wezempilo Dr. Joe Phahla ngonyaka odlule waveza ukuthi medical legal claims against government amount to a whopping 21 billion rand over the past 2 financial years. Imali lena ebengenza omkhulu umehluko emkhakheni wezempilo. Ubudedengu kwezokwelapha kushiya obukhulu ubuhlungu. Ake sizwe imbiko yalaba bayithola bekulobu buhlungu nesilethelwa intatheli yohlelo ulindo kuhle simelana.
Unokwanda Mukwela ukholelwa ukuthi ingane yakhe ngabe isaphila uma abasebenzi basesibhedlela sasesibukeng bamnaka ngenkathi ebeletha. Umokwena uthi abahlengikazi bakushaya indivo ukukhala kwakhe ngesikhathi ebeletha.
Continue ngama pain ngithulile. So la kule patient le angivalele nayo. C2 lapho le kitchen leyo. Uchecka le patient ukuthi mina nurse na inhloko ngicela ungincede. And then wangilingisela dewe bengikhala ngakhona like nya uyarasa. Inhloko mntana bese ivela and then I tried yajika. So uma ijika because bevele kancane yajika. Ngiyamtana nesi ngicela ungincede. Yabuya futhi inhloko seyiphusha kakhulu lapho. Nesi wangishaya inhloko seyivelile yemntwana wahamba. And then umntwana wasala waphuma wakhala. Ngamemeda nesi lutho kunginceda ngamemeda like Screaming for more than 30 minutes.
Ngokusho kukaMukwena kwaba khona impikiswano phakathi kodokotela ngesinqumo kumele basithathe ukuze kuhlengwe impilo yomntanakhe.
What about doctor batos check? So doctor makafika kimi wang check. And then wang check was okay, you right, ivulekile iyadilate. So kwata isinya yakhe. Makuta isinya yakhe wathi kule senior I'm thinking ukuthi patient yethu sinike ma steroids. And then the senior wathi no, injuse and let the baby be. My steroids. And then the junior doctor wabuta ukuthi why singamniki my steroids wathi it's a waste of time. Get fun. And then wathi uqala ukustangithi bayini trusted ebar. And then ulona senior doctor wathi hayi get fun as waste cut. If sizama ukusave lona mntwana bayingabantwana abasihlala sibasave.
eLimpopo umndeni waseThaiposh uthi ufuna izimpendulo emva kokushona kwendodakazi yawo uHumoto Rama. Lo mfundi oneminyaka engama-20 ubudala waseCape Town TVET bathi washona ngemuva kokujova umjovo wokuvimba inzalo emtholampilo osekoleshi. Umama kaMufi uAnna uthi udokotela waveza ukuthi kwakukhona ubudedengu ngasohlangothini lomtholampilo wakuleli college nokwaholela ekudluleni emhlabeni kwendodakazi yakhe.
After losing her life in the theater, the doctor called us to the office where he showed us pictures of the amount of skin and tissue he removed from her body. He said that the injection from the college clinic has caused a huge damage to her body.
Zombili lezi zisulu zithi zifuna ubulungiswa ngalezi zenzo.
Into le inganika iclosure. Mina kuthola ijustice. Yeah, totally justice. Though after justice akhona mntana ayeke asabuye. But it's justice really we
are sad and hurt as the family because of what happened to Komoto. The parents can't cope at all. We call on Capricorn TVET College to take the responsibility of her death and fulfill its promises. It must also provide psychosocial support to the mother because this incident has traumatized her.
Mbukeli, yini engenziwa ukugwema ubudedengu kwezokwelapha nokudla Umnyango amabhilion amarandi iminyaka yonke?
Sibonge intatheli yohlelo ulinde kuhle simelane ngombiko ukudingida kabanzi ngalokho asamukele ihambele zethu mbukeli umnumzana uPhuhulo Mayisela nokusekela mqondisi ehhovisi leHealth Ombudsman kanye nodokotela Phesi Mahlathi nokusekela mqondisi weHospital Services kumnyango wezempilo kazwelonke siphinde sibe noAndiswa Gowa a medical legal expert nginibonge nonke ngesikhathi senu ngizoqala ngawe baba uPhuhulo. How bad is the situation?
Nokubonga it's very bad. Let me just put it categorically clear to say it's very bad. Our office since April, now we are on the 5th month. We have already received around approximately 946, roughly around that numbers of the complaints that are lodged within the Office of the Health Ombudsman.
What kind of complaints?
Mostly we categorize this into 3 categories. The first category, we call them the low risk that can be resolved. And those ones, we refer them to the hospital to deal with them. It might be the issue of waiting time that did not harm the patient, but the patient is complaining of the time that he has taken to be assisted. But we have the medium risk rated cases that are seriously, and we also have high and extreme. In terms of high extreme, let me tell you, Nokubonga, because I'm working as a deputy director for assessment, where all these cases, they pass through my hands, is very bad. You find this, like they are talking about the midwifery related cases, where the baby has passed. When you look at the acts and the omission, really, they are propelling us to ensure that we investigate such.
Dr. Mahlathi, is this negligence yabantu abasebenza ezibhedlela ngenxa yokuthi abenendaba noma khona okunye okwenzakalayo?
Well, thanks Bongewe for providing us the opportunity. Maybe ngamangale ngokuthi what I heard from the patients or individuals can fall into 2 or 3 areas. Okokuqala is just the skill for listening from some of our professionals. Okwesibini is the caring, ukunakekela. Those 2 would then point to a culture, that we have. And one would say that there are instances where there are individuals, but there are several reasons maybe singajonga kuzo. Okokuqala is just the local management. Ukuthi is the local management, where ifake kakuhle na inhlelo ukuthi abantu abeza ezibhedlele or clinics are well cared for. Okwesibili, we actually have to look at the training. Is ukuthi are professionals that we have who are involved in that bane gaps abanazo na in the training, that they received. There are systems in place to improve the training as umuntu esebenza over the years. The other one actually has to do with the administrative systems, ukuthi, where ukuxhumana between the various aspects la esibhedlele, whether umuntu ulimele use-casualty or ufikela apha yobeletha khona, simply because quite a number of areas, have to do with pregnant ladies. I think from evidence that you are given now, oral evidence is labo abayoded complaining about the way abaphatheke. So I think that various issues,
So talking about the various issues, but I wonder, Dr. Mahlatsi, are they taking this opportunity to be trained? And ngibuza lokho because administratively it looks like they don't even know what to do. They cannot even have systems to track a patient. Sometimes you find, for example, abantu behlala at the admission ward for days on end waiting for available beds, and sometimes they don't even get told ukuthi yini iprogress enziwayo.
Yeah, well, if for instance you talk about Ibara is overloaded. It's overloaded because ayinazo a number of hospitals that fit into it. So you get people that should be presenting a clinic going straight to Ibara. It's actually merely a matter of being overloaded. Mm-hmm. And many of these hospitals are like that. Now the question really is whether clinics are actually properly being utilized now by people agulayo, because if they don't find joy at clinic, then they'll go straight to Bara and not even go to a district hospital. So that is the major challenge that we're actually looking at as we revisit is better. When we talk about professionals, with clinical skill, they are well trained. There's no doubt about that. And the problem is actually being overworked. Systems may be not talking to each other. That is where the biggest problem is. And of course, the caring aspect is the other one.
And I'm going to come back to talk about that very caring aspect. Ngoba hiyo enye into esiyibonayo ukuthi iba ngathi iba inkinga kakhulu. Mbukeli ake sithishelele edolo siyabuya. Mbukeli sibonga kakhulu, asiqhubeke ngengxoxo yethu ekhuluma ngezibhedlela kanye nobudedengu esikubonayo kwezokwelapha. Sisandiswa into esibonayo la ukuthi kwesinye isikhathi abantu abazi ukuthi yini medical negligence. What constitutes that?
All right. Ndiyabulisa Makhumalo ukuqala and ndibulise neguests zethu. I just want to say medical negligence yenzeka xa udokotela okanye the nursing personnel ingakhange iacte accordingly. There are standards and protocols that medical practitioners have to follow xa bezotreata umuntu. but sometimes they lack that because of various reasons, as explained. And also, I also wanted to add that sometimes even the resources as South Africa's NAS, they create problems in terms of medical negligence. Like I made an example over a break, sometimes there's an emergency, maybe for Caesar, section. Umama okhulelwe but uthola ukuthi isibhedlele esimela refer kuso okanye transfer kuso sikude mhlawumbe kwilali esezantsi. I know for example Eastern Cape where uzothola ukuthi kufuneka kuhanjwe ngegravel road for maybe an hour or two to get to i-academic hospital, which is ekwi-CBD yaseMthatha. Then you'll find ukuthi that time umuntu one-emergency or need emergency operation akakwazi uyifumana. So there are a lot of issues cause medical negligence. But before ndiyeke kancinci, I just want to say mna apho ndifeaturisha kakhona ndingena kakhulu as an intermediary kwi-Department of Justice when they've got problems where the cases sezilitigatiwe, then intermediaries ziyangena ke ngoku to try and prove as cases medical negligence.
And how easy is it to do that? Because siyabona khona manje amabhilions, and okusho ukuthi uhulumeni must pay all of this amount of money instead of reinvesting it ku healthcare system eyidinga kakhulu imali.
Yes, no, definitely. It's very difficult because, for example, mna, as one of the intermediaries of South Africa, I normally handle about 300 matters in my own office. And according to a report here last year, there's an increase in medical negligence cases by 23%, meaning that we are wasting billions and billions with cases of medical negligence.
And Dr. Maisela, one of the things Sarah Bonang is that in some of these instances, and I wonder if you've seen them as an ombud, is that one, you sometimes see a collusion between a lawyer, between a doctor, and everybody else involved in this particular, cases, and that also further compounds the problem. And I wonder how big of an issue is that from where you are sitting. Let me just highlight that as the health ombud, we are independent. We don't get into those collusions. What we do, we investigate or we assess the complaint fairly, and we make the recommendation to the Department of Health or whoever, if it's the doctor, in making the point that that thing does not happen again. You remember recently when the health ombud, the outgone ombud, yes, Prof, when he was giving the outcomes of Rahima Musa Hospital, he has made the recommendations to that. And whether they will collude on the corners, but what we do, we consider, we investigate, and we dispose this complaint in a fair and a procedural manner according to National Health Act. And Dr. Mahlatsi, this is also, one thing that adds another layer into this conversation, the collusion in some of these cases between a state official, a lawyer, as well as some of those in this particular sector when it comes to these claims. How big of a problem is that?
Well, it is a problem. It's difficult to quantify it until matters go to court. But what we are doing to try and address the problem is to make sure that we go more on electronic patient records. Because into bisenzeka kubiwa kwe files ze patients where you find into igwetha line file, the original file, but you don't have the file, which would mean that it was stolen, from the hospital. So to try and curb that issue is to go on electronic patient records, so that, but also to make sure that whatever is recorded there is very clear and according to the standards and procedures that it should be. But kunzima ukuthi how big that is at the present moment, because it would really depend on the outcomes as a court.
Andy, so you're somebody that handles these particular, matters from a claims perspective as the intermediary. There's something else that we've seen over the years that is, not going away. And that's around cerebral palsy, ebantwaneni. Yini into eyenza ukuthi Wena, from your vantage point as you're handling these particular matters between these two entities, ukuthi sibe nama cases angaka weingane eziphuma zina that condition, and also imali ziphume futhi in order to be paying for, you know, the damage that would have been caused.
All right, njengoba besichilo bangweqaleni, ne, there are various reasons for that, especially maternity care. And we know ukuthi when we're looking at a compensation, yeyona ikhupha imali eninzi, because you're looking at a life yomntana until death. So when you calculate the costs, the negligence, you're not just saying, okay, there was a fault here, but the state has to take care of the costs zomntu until erfike ekugqibeleni. That is a problem enkulu. But if I can just go back, kulento yokuthi i-attorneys ziyakholluda nabantu bonke. But ekuqaleni, there's always a problem. Let's start there. Ndiyavuma uDr. xa esithi sometimes ziyabiwe records, but I've seen ukuthi kunzima uba siprove cases because sometimes zithi records zikhona ezibhedlela zingafumaneki. Then it becomes hard ke ngoku ukudila nezo matters ngoba akukho i-proof.
Azifumaneki because somebody would have hidden it,
yes,
so that they don't get into trouble.
Yes, in terms of the adverse event recording ezibhedlela. So zingafumaneki records. Now ke ngoku iputhe istate at a back foot, in the sense that bangakwazi ukuphendula ukuthi what really happened. Then it depends on the judges to say, okay, fine, we sizodependa kwi-evidence kamama. Then istate singakwazi ukusidefend ukuthi no, by the way, as a doctor, I did 1, 2, 3, 4, 5 to save this. So we've got problems ezininzi, especially with the cerebral palsy, because when you're dealing with the cerebral palsy, you need to understand what are the standard protocols. If umama mhlawumbe ungenile, ufuneke testiwe enze itest ethile, ufuneke measurishwe into ethile, uthola ukuthi some of those steps have been skipped.
And ngifuna ukuthi on the other side of the break, then we talk about what becomes the solutions, ngoba ultimately these are billions mina nawe siyidingayo masifike ibhedlela ukuthi ayisetshenziswe ukuthi ibhedlela ithuthukiswe. Mbukeli, siyabuya. Mbukeli, sesiphetha-ke sikhulume ngey'sobululo zalenkinga. Sibone ukuthi senze njani ukuze sikwazi ukuthi ubudedengu sibugweme. Ngizoqala ngawe Mnumzane Mayisela, ngoba lento le niyayibuka kakhulu and ziningi izinto ezinikhathazayo. It's either competence, it is either, you know, the billions of rands that are getting wasted. And I wonder from your point, yini into manje that can be done, the easy wins that the department can do in order to fix this problem?
From the health Ombudsman perspective, we believe that if the Department of Health can really ensure that they are doing trainings. I heard Dr. Mahlati saying they are doing training. Yes, when you train as a student, you are getting the whole training. But now you remember they will tell you that the government does not have money to take people to these kind of trainings. At the end of the day, you find that a person has been trained. You know, medicine is evolving, and as it evolves, it needs people. I think the other issue, as you were saying, the processes. You know, our government has got good policies, has got good maternity guidelines. But what is difficult is the implementation of such guidelines that the department has put in there. And I think if really they can prioritize the issue of doing this in service training and ensuring that they really take responsibility when someone has done something that is equivalent to negligence. Although in Health Ombudsman we only talk about clinical mismanagement because we have been regulated by the procedural regulation and also National Health Act. That tells us lawyers will talk about the negligence, but we will talk about clinical mismanagement. I think if the department can also ensure that it liaises with the HPCSA or the regulatories that are responsible for these nurses and doctors to ensure that really things are being taken into serious if they happen.
Dr. Matlati, very briefly, from your side, what can be done?
Well, I think first of all is just to start at the basic level, especially for omama abakhulelwe. They must make sure that they are very regular with clinic attendance, so that some of the problems phikishwe early and not later on when where they are advancing their pregnancy. Okwesibili, it's important that practitioners, doctors and nurses, ikakhulu the leadership of the medical and nursing professions, make sure that they basically have an introspection in their profession and say what it is that we can be able to improve based on your contribution that we do. We are engaging with the education institutions, both nursing, medical, and so on, to say let's actually have a real look at the issue of skills. Lastly, it's very important that the clinic, what we call the clinical governance, in the hospital scenarios, those rounds that involve everybody, seniors and juniors there, because medical errors but they need to be minimized so that we don't have unnecessary ones.
Okay, and then for you, understand about 30 seconds?
All right, just two things for me. If usingajonga esibhedlele, the basic thing is screening. Screening, when you get to private institutions, you are labeled yellow, green, red patient. So I think that will be, it can cut a lot in terms of litigation. And then when we come now to litigation processes, a government should be proactive in getting records. Because the way to defend matters is to make sure that the records are there.
Yeah, inkulu lenkinga, kodwa I do hope ukuthi at some point we talk about it again. Sibone ukuthi yini into engenziwa ukuthi sikwazi ukuthi lenkinga siyigweme. And as we say, yes, we will have problems, but how do we ensure that prevention and something like screening, Andiso, is quite critical. Mbukeli, siyabonga kakhulu ukuthi uhlanganyele kanye nathi futhi ohlelweni. Sikubonga nje kakhulu kanye nethimba le-Asikhulume. Sibonga nezihambeli zethu uDokotela uPhansi Matlati ongusekela mqondisi Hospital Services kumnyango wezempilo kazwelonke, saba no Andiswa Gowa, a medical legal expert, as well as umnumzana Phokhule Mayisela ongusekela mqondisi ehhovisi le Health Ombudsman. Mbukeli thina kanye nethimba le-Asikhulume sithi nizale kahle.